can remember it like it was yesterday. I received a call that my father had quadruple bypass heart surgery. Being from an active family, this was hard for me to take and hard for me to see someone that I love be so fit and so active and struggle with a health issue. Aside from my personal opinion and experiences, here are some statistics that you need to hear. These are from the Center for Disease Control in Atlanta, Georgia. Nearly 600,000 people a year suffer and die from heart disease. That's 1 in 4 deaths. 1 in 4 deaths. Heart disease is the leading cause of death in males and females, and it's very costly. $108.9 billion to be exact. That covers prescriptions, healthcare services, etc. The Southeast region, which is the region that we live in, ranks among the top. I haven't mentioned any other diseases such as diabetes, cancer, and lower respiratory diseases. As a person who has watched relatives suffer from diseases, I understand the problems associated with health and wellness. I will also serve my community as a pharmacist in the future, and I take it upon myself to educate my peers in my community on the importance of exercise and its relation to health and wellness. As someone who will be dispensing medication to my community, I stand before you not to criticize your health habits. No one's perfect, especially not me. I hope some of these eye-opening statistics and testimonies will help you realize the importance of exercise. Today, I would like to explain the need for exercise. Next, to provide a clear understanding of how exercise can improve and even reverse certain diseases. And finally, I want to encourage you to alter your own habits. That way you can live the most efficient and healthy life possible. Believe me, sitting on the couch is great. However, it's hard to exercise on the couch. I'll begin by explaining the need to exercise. The Mayo Clinic, who's way smarter than me, reiterates this with some statistics. Exercise has many benefits. It can help you control weight. This is done by the burning of calories. More rigorous activity leads to more burning of calories. Also, keep it simple. It's the little things, such as, let's take the stairs instead of the elevator. Exercise can also boost your energy and mood. This allows the cardiovascular system to distribute oxygen and nutrients to tissues, and it also allows the body to stimulate chemicals, which we all know endorphins, to allow you to feel relaxed and accomplished. In addition, exercise can help improve sleep. You can go to sleep faster and remain in a deeper sleep. And finally, exercise can be fun. I know when I exercise, I'm able to connect with people and form many friendships. Now that the need is established, let's go into how exercise can improve and even reverse certain diseases. If you're not convinced that exercise is important by now, you will be soon. Physical activity and exercise can even prevent the dreaded disease cancer. The Journal of Nutrition in 2002 stated that a decreased risk of cancer was associated with an increased risk in exercise. It was convincing for breast cancer and colon cancer, probable for prostate cancer, and possible for lung cancer. Some public health officials issued exercise guidelines. They say 30 minutes a day of moderate to vigorous exercise 5 days a week will be sufficient. Exercise can improve other aspects of those lives of people suffering from cancer. This can be from detection to coping to rehab. All these have been associated as improving with exercise. 2 Canadian physicians, they're epidemiologists, state that the mechanisms, which that's exactly, and I mean exactly, how the body deals with cancer through exercise is unknown. Even though this is not understood, evidence does suggest that exercise lowers biologically available sex hormones, which this applies to breast cancer, prostate cancer, and endometrial cancers. Research indicates that from exercise, this does help with these diseases. Of even something such as cancer that has even puzzled the best doctors on the planet for years. That's enough of the medical jargon. I can stand before you and tell you and let you visualize how much better your life would be if you exercise. Instead, I want to show you a man that lived it. So if you don't believe me, maybe you believe him. The program he was talking about was established by Dr. Dean Arnish and was an established program that is scientifically proven to not only combat, but reverse heart disease, just by exercise. Medicare and private insurance companies are now beginning to cover this program. 96.5% of patients saw improvements in chest pain, and the average patient lost 13.3 pounds in the first 12 weeks and nearly 16 pounds in the first year. These benefits are obtained by something just as simple as exercising. If these problems continue to be ignored, this man may or may not have been able to tell his story. Hopefully by now we see that exercise has a profound impact on health and wellness. Now it's your turn. It's time for you to act. Recall back to the beginning. Exercise can be fun. Once you get out there and experience this great feeling, your body will take care of itself. You don't have to enroll in a program such as Dr. Ornish's. However, the benefits of exercising are uplifting and boost your overall health. Becoming knowledgeable of this can translate into a great experience. So nobody's going to run out of this room and run a marathon. However, if we come together and realize its importance, it will be well worth it. And instead of being a statistic, you can redefine that statistic. I challenge each and every one of you to evaluate your lifestyle. I also challenge you to engage in more exercise and physical activity. Hit the gym early in the morning or go for a run later this evening. Make it a prolonged effort. It'll be worth it. A large successful brand once said, just do it.